research platform. Sir has published 38 publications and written several books and chapters in both national and international wise. Dr. Varadarajan sir's contributions to psychiatry are nothing short of remarkable. As William Osler once said, the good physician treats the disease and the great physician treats the patient who has the disease. Dr. Varadarajan sir's expertise spans across a range of areas including severe Tourette syndrome and consultation liaison psychiatry, always with a patient-centered approach that truly embodies this ideal. We are truly privileged to have you, Dr. Varadarajan sir, here with us today. His wealth of knowledge and experience promises to provide us with
good morning to all of you present. At the outset, I would like to thank the Municipal and Organization Committee of this Indirani Medical College, Indirani Nursing College for having me here. So, I very much thank you for a very warm introduction. So, let me start with the topic. I was assistant professor at the Department of Psychiatry. So, it is a very challenging task indeed that challenges in mental health practice are clearly given as first session, so I like to discuss as to what I can. And this presentation is going to be in the lens of psychiatrist, which I have also over the years. So coming to the topic, as we all know, nursing is a quite demanding profession, and when it comes to psychiatric nursing, in fact, so this is quite demanding and Himalayan task for people because it involves a lot of human interaction. When compared to other types of nursing, it also involves human interaction, but here the emotional aspects of the patient's needs to be dealt with. So this is quite challenging task, and most of them, when you look at the psychiatric ward aspects, what happens is that rather than managing the patient or developing therapeutic relationships with the patient, most of the tasks end up being handling the administrative tasks, which is quite happens. So, moving ahead to presentations, like I told you, this presentation is entirely going to be through the lens of psychiatrists as to how I have observed over the years of the past 10 years, having worked in psychiatric wards in medical colleges, or in government, or in private psychiatry, or in NGOs. So I have worked with the NGOs also. So this presentation is entirely going to be based on that. There are quite a lot of tasks which a nursing officer or a nurse is supposed to take care, and it is quite challenging to do. So it can involve patient care, it can involve administrative tasks and educated relations and dealing with stigma. So this is just like too many responsibilities being given at the same time, and it's not easy for many people to handle this. When I try to look at the literature, with respect to the challenges of mental health nursing, as you can see here, right from the 1990s, it has been almost in the 3 decades when psychiatric nursing was initially started, and this problem is continuous process. This is quite demotivating, in fact, that certain things cannot be dealt with. So we are in with societal stigma, so which is quite needs to be attended at the grassroots level, and it is unlikely to change the throughout the generation also. But there are certain things which need to be done at the society level. I would like to cover on that. So, anybody, this is World International Nurses Day. Sorry? 12th May. So, we are about 2 months ahead of that. So, in 2024, the International Council of Nurses developed the thing called as Our Nurses, Our Future, the Economic Power of Care. Now, making this theme of economic power of care is something very instrumental because administrators, policy makers try to influence the decision making and downstream ability to change. Only when there is money involved. So, hence this theme of the conference was created at this. And last year, it was in fact born by the Global Nurses Organization that it has become a global health emergency, especially when it comes to challenges facing mental health. So, moving ahead, I challenges faced in mental health practice? Your names won't be visible. Just that whatever response you gain, it will just pull as a word cloud. Can you just open this website called Slido in your mobile phone and you just enter 296.083. I request all the students to that we have about 100, nearly 100 people over here. Can everybody just log in? People able to log in. You can just see this code over here, 296.083. As I see the participants, there are literally 0 over here. So, this slide is log in. You can just go to this website, slido.com. As soon as you enter, you can just enter the code. So, 1 people have joined. Just writing whatever comes to your mind, 2 keywords or whatever, can be sentences also as to what you think are the challenges in mental health practice. I would need at least 10 people move ahead. This is opening for your I need more participants to log in. Suppose the number is still over here. Okay, so there are a few responses. As you keep on, technically the responses will pop up over here. Assault, negativities, patient, personal, repeated, critical, patient problem, discrimination. Okay. Stigma, very good. Identification of mental illness, lack of awareness, difficulty to get cooperation of the patients, negative feelings. Many people are having negative feelings, stigma, lack of awareness, lack of healthcare professionals. Okay. I suppose somebody had addiction over there. Identify mental people, somebody there is a video related price is something that we will do. Okay. Social environment, lack of idea resources. Right. So it's quite good that people are interested all over here. So these are in fact the challenges which many people face. So what I try to do over here is try to compare all these things. You people are more right. So related challenges, patient-related factors, war-related factors, societal stigma, social media, and mental health. So I try to cover each one of these in separate ways. So when it comes to major work-related challenges, as many people have pointed it out, the most important factor is lack of healthcare professionals or number of nurses over there or who are posted access, especially in psychiatric ward or elsewhere. The patient staff ratio is quite poor. So that is the most important factor. Because of this, the staff perceives nursing officers perceive that the workload is more, and unlike other patients, constant monitoring of patients is required, not only with respect to vitals monitoring, as to how the patient behaves, how do we handle such patients, and overall there is difficulty in documentation because we need to handle all those things together, just like I showcased in the picture. So, anybody can you just tell me what is the superior nurse and the patient ratio in a psychiatric ward aspect or in a psychiatric let's say ICU or any other place? What is the nurse patient ratio? 1:1. 1:1. This is 1:1. ICU space. You are very right. And when it comes to psychiatric ward, 1:3. 1:1. Is better than that. So this National Medical Council, Nursing Medical Council, they have 2023 had released a document where they say that psychiatric staff, how it should be. So in a psychiatric ward, just like compared to other wards, it should be 1:5. And when it comes to ICUs, it should be 1:1. And they say that the person who should be posted in a psychiatric unit should be somebody who has MSc in nursing qualification, especially related to psychiatric nursing, or they have some sort of psychiatric experience prior. So, having said that, this is not the case across India and even across the Western countries. Now, that is a major limitation and the challenge. When it comes to the National Mental Health Care Act, this act is something which we must know. So, what the National Mental Health Care Act says. So, it defines mental health nurse as somebody who holds a diploma degree in general nursing or diploma degree in psychiatric nursing. So, they have taken away that even general persons who do not complete MSc psychiatric nursing can be a part of psychiatric ward. That is not something bad, but in fact when they are not able to handle psychiatric patients, or they do not have adequate training, or they do not have interest in psychiatric nursing. So what is the point of posting them in a psychiatric ward setting? So this is something which is a major challenge. So coming to the next one, that what happens during my years of experience, what I have seen, even it happens in Chipmur, that somebody who has completed MSc psychiatric nursing from MANS or any other medical colleges or any other nursing colleges. So these people are posted in, let's say, ENT wards, ophthalmology wards. So what is the point of posting them over there? They have special expertise training, and when these people are not posted as per their academic qualification, ultimately what happens is that they become distressed and they become frustrated. At one point they think that as to why did I choose this field. So this is something which happens, and there is lack of proper setting for psychiatric patients, where there are other limitations with respect to the ward which I will be dealing in later. This is one of the major limitations. So when we have a psychiatric ward setup, of course Venkateshwara Medical College also has one. So in psychiatric ward setup, when there is if everybody is somebody who has completed BSc nursing, or let's say everybody has completed MSc psychiatric nursing, then that issue is different. But when there is a mix of psychiatric nursing and somebody who has not completed psychiatric nursing, you know that there can be sort of ego problems or clashes which can happen. And this again sort of poses a challenge especially for the nurse who has completed psychiatric nursing and who is posted as in charge. It becomes difficult for them to coordinate. So again, having said that, previously we listed down the challenges. Few people had earlier put up that patients are violent, patients are difficult. Can you just tell me what are the patient-related factors which can be there, apart from the fact that patients are violent? What else can be there? Again, you can just log into the website, keying the same code. Can you just try to tell me? Having said previously what are the challenges we face, there can be some challenges with which we can identify in a patient, which will be difficult for a nurse or a psychiatric nurse to deal with in a psychiatric ward or even in the community setting. So what can be the challenge? This slider was found out by this website slider was found out by an introverted person. Many a times in classes, when teachers suddenly ask you the question, come on, you say an answer, we feel disinhibited, right? That the person doesn't feel like answering, even though they know the answer. They feel like, what if they commit a mistake? What if somebody tells something bad? This is one sort of person who has invented this, so that anonymously you can just type in your answers. It will be easy for the interaction. Lack of insight, excellent. Non-cooperation, poor knowledge, money, what is RSH? I don't know. Aggressive, spirituality, okay. Can I get some more relevant answers? Lack of self, not accepting business, okay, that is lack of insight, lack of psychiatric nurse, okay. This, I mean here, the patient-related challenges. What in the patient if you find aggressive, exactly, very good. Chronic illness, suicide, excellent. Okay. A few more answers, please. You can type in even more than one response if you feel like. Social stigma, very good. Cultural belief, okay. Medication adherence, excellent. Fine, you people are making my job simple. This is all the answers which I just brainstorm myself and try to make it in the slides. So just a few more responses, we'll proceed further. Communication barrier, poor accessible, overburden. Okay. So coming to the patient-related factors, it's more or less the same. The most important factor being many patients who have psychiatric illness do not have insight at all. So this insight makes it difficult for us to establish rapport with them, to make them take medication, and this can be a challenge in fact. So unlike patients, other patients where this is not the case. We psychiatrists, so there's also psychiatrists, sir, may agree with me that many a times we just come into the rounds or we just interview the patient and our job ends at that. Many a times psychiatric nurse or the nurse who's posted in the ward is the person who constantly involves with the patient and have a constant supervision. So when patient lack insight and there are other factors which I'm going to list, it is quite difficult for them to manage considering all the administrative tasks which I told about. So patient can be suicidal, patient can be extremely violent, and when it comes to managing patient with drug addiction, especially alcohol or somebody who takes cocaine, cannabis, these people have strong or heroin in fact. They have strong craving. So when right from the moment you admit in psychiatric ward, they just want to say that I want to get out. They just stand near the gate and say, I want to get out. Please leave me, please leave me. And they'll keep on coming and torturing you. Yeah, because you are the person who are almost 25 years and there the ward. It really becomes difficult, and especially when there is a patient who is disinhibited, patient is increasingly sexual, or the patient tries to disrobe herself, remove their dress in a ward where there are males and female wards quite adjacent to each other. That becomes really an issue when how to handle these such patients. Next is that it is also common in general ward settings, but the patient tend to abscond, and especially when there is an open ward setting. And there the patient absconds, you try to do in all the procedures, discharge procedure, everything is done. And the next time, again somebody brings in the patient at the moment you are trying to abscond. And this all leads to frustration, anger. Patient refuse medication, as somebody pointed out, care with liver-related issues. So most often in psychiatric ward, what happens is that patients do not have insight. Patient caregivers also get treated along with them. They try to take care of the patient, and they often try to ask you things down as to how to deal with such situations and what to do further. And during these situations, we are not in a position to answer them back adequately because you don't have the time. And what will you do? So these are certain issues, patient-related factors. And one more thing is patient fighting amongst each other. I mean, when the beds are quite close enough, patient will be lying here and there, and they'll be shouting, or at times they can be, not interacting with them. The other patient will constantly poke the other patient, and ultimately it comes to the staff nurse who is in charge of the ward. And having all these issues said, and when there is a limited staff nurse, let's say, what happens in Jipmar, I could say that only 3 staff nurses are posted for a 27-bedded ward. The service also comes in. So this really becomes an issue, and when all these issues keep on going on, ultimately what it leads to is anger and frustration among the nurses who are posted. So there is a reason for me saying this. I will come to towards the end. And there are again war-related factors that poor inpatient settings, as I told you, even though there are separate male-female wards, there is no clear-cut demarcation that makes it difficult for the staff nurse to handle. There is a lack of adequate bed space, like I told you, and that creates the issue. Limited safety measure options. So when patients become really agitated, violent, apart from giving them injections, you need to restrain them. When restraint options are not available, security options are not available. When female patients get agitated, you do need a female security. But such system is always not in place, and you need the male security comes in, handles the female patient. At times it might not sound good. In fact, that could be seen as a violation of human rights. In fact, one of the most important factors, other important factors which is still prevalent across all settings is poor coordination. So we are all a part of a team, a psychiatrist, nurse, a psychiatrist, social worker, a psychologist, or a psychiatrist. All should work in a coordinated manner in a part of a team. Most of the case, it doesn't happen. The psychiatrist comes or the junior resident comes, they talk to the patient, they just write the orders and go away. And the psychiatric nurse or whoever the nurse posted, they just note down the things and execute the order. There is no communication as to what needs to be done to the patient, what should not be done to the patient. And when this thing happens, everybody doesn't feel together that they are a part of a team. Then that can create issues, and that when this coordinated effort doesn't happen, it leads to multiple level of challenges. So, having seen these things, I was predominantly speaking in a perspective of the ward settings. So, there are multiple authors. This is one of the heavily cited papers in one of the major mental health journals, where they try to evaluate whether these challenges are present only in the institution or the ward settings or in the community health setting. So what they found was that this is something which is more common in both the settings. Most often in the institution setting, because it's a closed ward, they cannot move away, unlike the community. It is more common in the institution settings. And having said this thing, please keep it in mind that this is something which is not only common to India. It is common across all the Western countries, across every part of the world. This is a study in Australia where they try to qualitatively assess what are the mental health challenges. So as you can see the highlighted areas, violence, aggression from consumers, bullying from colleagues, low staffing levels, poor skill mix. So this is something which is not common to India alone. Wherever you go, this problem persists. Quite discouraging, right? So having said that, this is just a video. I will just like all of you to have a closer look at this video and try to tell me what do you see in this video.
Fractions are your friend. Use fractions everyday life. You just don't realize it. For example, say your mother makes a pie. Cuts the going.
So, seeing the video, anybody wants to tell me what it is? What do you see in the video? Anyone? Attention deficit is not okay. What else? Any student wants to say? Sorry? Excellent, very good. It is Tourette syndrome. Anything else you want to say? Anybody else? What else do you see in the video? Anybody who is not from, who is not a tutor in psychiatric nurse, who is from any other department, presently? Any other department is here? Okay, so what is? Okay. So what is? Very good. It's pointed out that it's Tourette syndrome. What else do you see in this video? So who are all from psychiatric nursing who are studying here? Can you just raise your hands? Nobody is there? Okay, I see one hand. Okay. Who else is doing psychiatric nursing here? MSc psychiatric nursing is here. So who else is? Please raise your hands. Okay, you people have to answer this thing. So somebody rightly pointed out it is Tourette syndrome. What else do you see in this video? Anybody? Apart from Tourette syndrome, what do you see? What has been happening? Can you just play the video again?
Fractions. Fractions are your friend. Use fractions everyday life. You just don't realize it. For example, say your mother makes a pie. Cuts the
Anybody would like to answer now? What else you see in this video? Okay, ma'am. This is somebody with the Tourette syndrome. Possible autistic features may be present. Yeah. Okay. What else? Hypomania, hallucination. What else? Sorry? Auditory hallucination. Okay. What else do you see in this video? What is happening in this video? Lack of impulse control. Okay. Excellent. Child is neglected. Excellent. Very good. So anything quite related to what ma'am is saying? Child is being neglected. Bullying. Excellent. Very good. You people are moving quite closer. This is something which you people have answered previously also. Isolation. So when it comes to mental health or somebody suffering from a psychiatric disorder, what do we do? What most people do to them? In isolating them, they try to push them aside, try to make them excellent, very good. So that's what the word I was expecting. So stigma. So stigma is something which is persistent and pervasive. Now, having seen this video, all of us are inclined towards finding out what is the diagnosis, what is the patient is having. I mean, even it happens quite the same. But nobody or not many of them are inclined in knowing what is happening around this patient. When diagnosing, treating them, it's not a big deal. But the other aspect is, most important aspect is stigma, which most of the times we do not look at, although we know it inside our mind that mental health patients are stigmatized, psychiatric nurses are stigmatized, psychiatrists are stigmatized. You must just know it in the back of the mind and try to understand that perspective and try to understand their behavior. So when I try to look at these papers from I think Savita Medical College and MNC Bengaluru, so where they try to find the attitude of knowledge and attitude of staff nurses working in a tertiary care hospital, they found that their knowledge is poor, their attitude is poor. But when they try to, they went back and tried to see, so the staff nurses it is poor. Let me go back and see somebody who has just started their career in BSc nursing. Again, they found that they have very high negative attitudes. In fact, many of them do not want to take up psychiatric nursing, which is quite understandable. So again, when we see it from the primary healthcare nurses perspective, who are completed and working in the in the field in the community centers. Again, this is a paper from MNC Bengaluru. So again, where they found was that more than half of them do not have negative attitude, and this is despite the fact that their knowledge is good. So somebody having knowledge of mental illness doesn't mean that they have good attitude. So because of this poor attitude, there is psychiatric nurses get stigmatized. In fact, it is not only present from your peers and colleagues, it is even present among the family members. So family members at times lack knowledge and they do not provide support. I know a staff nurse where she was barred from the family for working in psychiatric wards at least. So these are the various challenges which most of them face. So this is Devlina Roy. She has completed PhD. She is a nursing faculty, and she had pointed out in the Lancet issue that research is something which is lacking in psychiatric nursing, and they do not receive grants. Last but not the least, I was selected in the leadership program in Bangalore. So this was World Mental Health Director, Professor Sartorius. So he is called as a living legend in psychiatry. There was one thing which he starkly pointed out, that if you are not interested in psychiatric aspects, or psychiatric nursing or psychiatry, please do not take up that field. Many of the times what happens when you don't like the field and just for the fact that you have undergone something or your family members are undergoing something you want to learn, because of that, you won't be in a position to treat. This applies to psychiatrists as well. So choosing just because I don't have any option, again, you'll see all the things which I told you as a major challenge. Lastly, the one thing is that dealing with misconceptions, and this is with the boom of internet era, this is a major challenge. You will tell something to the patient and the patient will come and say me, Musk says me this. Elon Musk says that antidepressant should not be used. This antidepressant doesn't work. Okay, and there can be many other things which most influential people say. And these influential people say many things with respect to psychiatry aspect, with perception of general public varies, and this in turn can influence. And there again becomes a challenge for all the mental health professionals to counteract them and make them improve. So he says that SSR is zombified, and when you also have that attitude, or people also get influenced, it becomes a task for us to challenge them and make them improve. So having said that, just think of all the factors in mind. Psychiatric nurse, which involves a lot of human interaction. When there is a lot of human interaction, what happens? So what does this indicate? Having ward-related factors, patient-related factors, stigma, misconceptions, all these things going in a mind of a psychiatric nurse. Exactly. Stress, very good. So is there any other word for stress common these days? Depression, okay, related stress. What else? So this is AI-generated, by the way, so it's quite good. So what happens is that ultimately it leads to something called as a burnout. A burnout is something which is again a major challenge. Remember that International Council of Nurses say that the economy is shrinking. So I'll try to tell you why. So when a burnout happens, be it let's say physicians or any other medical professionals, it leads to all these things. They drop out from their job, they lose their job satisfaction. At times it can lead to marital discord. They feel that their morale goes down, they start cheating, all the productivity also goes down. These are something which can happen for the psychiatric nurse, for the mental health professional. Now when it see for the patient, there is certain major medical errors, there can be poor quality of care, patient satisfaction may go down, and they may take a longer recovery time. Lastly, when it comes to the health system, we are all a part of health system, right? So ultimately what happens, productivity goes down, increased use, ultimately drives because of absenteeism, it drives the economy also. So that is the reason why International Council of Nurses try to push through the economic perspective that much of the focus can be there. Just two more slides. So how to overcome them? It's not like which is easily possible. So especially those who are posted in psychiatry wards as psychiatric nurses must undergo periodic training in psychiatry, how to handle a psychiatric patient or how to handle an agitated patient. We often see that in psychiatric wards, people become most frustrated when they need to handle psychiatric patient. Doctor is agitated, doctor is frustrated. So when the communication is good enough and we are imparting them knowledge and skills, the handling of patients improves. Creation of more posts for psychiatric nursing and placement in, especially their placement in psychiatric wards would enable them better care, and choose your course wisely. Like I told you, when CO1, if you are interested, please choose the course, otherwise it becomes a daunting task for you. So I previously worked in ESA Medical College, so their psychiatric ward was not there. We were to establish, and I went and spoke to the nursing superintendent over there. And the very first thing I asked was like, give me the list of persons who are trained in psychiatric nursing or somebody who has completed MSc psychiatric nursing. So I got their contact, I just spoke to them, and they were literally more than happy to be placed in a psychiatric ward. And she went about right from the beginning towards the end in making what is necessary for the psychiatric ward. And they were very much happy. The job satisfaction improved. And the one thing which they told me, which still strikes me, and she's still in contact with me, although I left ESA college. Dr. Ji, what I learned, I am able to implement. So these are certain things, minor changes makes a world full of difference. So Banyan again is an NGO. It deals with homeless mentally ill people in Tamil Nadu in various places, and it has expanded across South India. So there again is something where I found which was not there in medical colleges, in fact, wherever I trained also. There was excellent coordination between the mental health fraternity, psychiatric social nurse, psychiatric nurse, or the psychiatrist. So everybody worked in a coordinated manner. Everybody gave their inputs. When everybody feels a part of team, ultimately patient can improve, and that's why we are here. Lastly, then there should be well-being programs or leadership programs or trying to enhance the quality of care, how to manage time, and there must be adequate representations from the national and professional bodies. When nursing profession is where your organization is quite strong and you can almost achieve anything. So we must make use of the organization and try to achieve certain things which are mandatory necessary for patient care. So I just happened to look at the college website. So I was surprised to find that there are quite capability enhancement programs which have been discussed, like leadership enhancement, language communication skills. If these things are organized in a repeated manner, this can improve the quality of the nurses in there. And this can, alleviate all the challenges which are listed on so far. So concluding, I would just say that challenges are universal. It is not only common to, psychiatric nursing profession. It is common across all sort of nursing, and apart from those who are involved in mental health. Psychiatry as a field is quite a rewarding profession once you take up psychiatry, because purely out of passion. Because you will be able to influence not only the patient but the entire family members in varying aspects. So if you're interested, please do take up psychiatry, and all these challenges which I listed down so far will mean nothing to you. And just because for the presentation purpose I have listed on all the challenges, but then once you are passionate, these things won't matter a lot. So again, this year's May 12th theme is that caring for nurses, strength and economies. So that is the reason why I pointed out the burnout and how it leads to decrease in productivity. So when international organizations and bodies try to focus on that, ultimately the quality of nursing professions will improve, ultimately patient care will improve. So I would just conclude my talk by saying that obstacle is the path. So behind every challenge, you can see that many wide range of opportunities open up. So with this, I conclude my talk. I would just like to acknowledge Mrs. Krishna. She is a psychiatric nurse in charge of psychiatric work, and she had given inputs for shaping this presentation. Thank you very much.
Thank you very much, sir. You have ensured the participating and the delegates. Now I request our moderators to moderate the session.
It's a very great session, sir. So, because when we talk about psychiatric nursing, psychiatric field, it is very difficult to find the people who is being deviated from this normal mental status. And then physical illness we can find with the normal signs and symptoms itself. But for the psychiatric, it is very challenging for all the healthcare professionals. You noted out, you just enlisted all the points, and you given a new path to identify, get some answers from introverted people also, that childhood, uptown. Even in our teaching practice, we can use this. This is the rightly time to address the mental health issues, because it's the most common thing happening everywhere and every day. We are just facing a lot of problems with this. So it's a very great eye-opening session for us. Even our delegates might have enjoyed and gained the insight about this psychiatric illness.
Yes, the Madam rightly said, it was an outstanding performance presentation. And I would like to say, you are elaborately says about the workplace challenges and what are the patients main challenges about their treatment and all. So it is really an eye-opening session for the students as well as the faculty. It is non-psychiatric related, department related person. So the burnout, you said it at the end, burnout about the psychiatric nurses, which is really a need for the society, because everybody thinking of the patient, psychiatric patient, no one think of the professions like psychiatric doctor as well as the nurses. And we need more focus on the whatever the things we are focused on the patient, as well as we have to more focus on the nurses, that is mental health professionals. As you said, lack of psychiatric nurses, and I would like to say even the psychiatric doctors also, lack of psychiatric doctors. We can count it very less. We are, even in our societal person, somebody asking for the psychiatric doctors, we are just thinking we are whomever or we know. So we are also lacking of the psychiatric doctors. So also, in my side, I would like to say the community people. When in the urban side, we will have the lots of entertainment things for the mental health. If we are thinking mental illness, we are going outside and we are earning something from the outside. When we are talking about the rural people, they may not didn't know about the they have literacy. You said lack of insight. So we should know, we have to concentrate on the rural side, community side, I would like to say so. Otherwise it was a great presentation. Thank you.
Thank you very much for the moderation. Now the session is open for the delegates. Any questions, any queries, any doubts you can clarify? You are having experts with us. Anyone interested to ask any question or discuss anything, you can put on that.
Hello. Just one more thing I'd like to add on it, didn't strike me then. So, me as psychiatrist, when people, MBBS students come to me or we have a BSc nursing students posted in the OPD, the one question which everybody asks us is that if I learn psychiatry, I don't know. Will I also be affected like that? Patients paathu one time enakku stress vandurum. So, I just draw a simple parallel example. For example, we have MSc nursing courses in anesthesia also. Anesthesia also is there. So those who are completing anesthesia or doing anesthesia will be obviously posted in operation papers. So, do you think that just by posting in operation papers, just because they are doing anesthesia, literally Tamil translates to Micro doctor. So this in fact struck me because I was in Chennai. I was working in a medical college and we had called the IPS officer. He is a very famous IPS officer who was retired recently. He posts lots of YouTube videos. And this IPS officer in fact told that, he in fact elevated the stigma to a level. So he told that psychiatrists அவங்க பேஷ் பைத்தியத்தை பார்த்து அவங்களும் பைத்தியம் ஆயிடுவாங்க, மயக்க டாக்டர் மயக்கம் கொடுத்து அவங்க மயக்க நிலையில் இருப்பாங்க. So all these things are coming from IPS officer. Just imagine, people in higher posts are saying like this. So I'd like to say that this is not something like that. If you are passionate about the field, you will really enjoy it. It's quite a rewarding experience. It doesn't affect you at all. And during the course, it is being taught that as to how to deal with it and how to avoid it, how to maintain a strict boundary between the patient and yourself. So this is something like answer that it doesn't influence you. Stress is something influences, but not that psychiatric issues is communicable with. It's not communicable.
Thank you very much, sir. You have elaborated nicely about the mental health care profession. Thank you, sir. Thank you very much. Now I request our respected principal ma'am to honor our resource person of the day with small token of accomplishment and love.
Knowledge is power. Sharing knowledge is the key to unlock the power. The second session of the day is on psychiatric care in traumatic event by Dr. Avin, Professor, Department of Psychiatry. Here with we welcome Dr. S. Radhi Devi Ma'am, HOD, Department of Community Health Nursing, and Mrs. R. Kalpana Ma'am, Associate Professor, to introduce the speaker and moderate the session.
distinguished speakers whose expertise and passion for psychiatry have earned him great respect both nationally and internationally. Dr. Avin sir, who completed his undergraduate and postgraduate studies in psychiatry at the renowned JICMR, has truly established himself as a leader in his field. His commitment to advancing the mental health care is reflected in his fellowship in psychosocial medicine from the prestigious World National Health Organization Sexology Institute, Pune. He is also certified by the Indian Association of Child and Adolescent Mental Health in Child and Adolescent Psychiatry, showcasing his dedication to understanding the complexity of young minds. His research contributions have enriched both national and international scientific journals, further solidifying his expertise.
So in recognition of this exceptional academic work, Dr. Avin was honored with prestigious awards for the best PG thesis in Tamil Nadu State and the South Zone year 2016. Such accolades are a testament to his tireless dedication and outstanding contribution in the field of psychiatry. And the greatest and most important problems of life are all fundamentally insoluble. They can never be solved but only outgrown. Dr. Navin's work exemplifies this growth, and we are privileged to have him to share his knowledge with us today. Welcome you, sir, for the session.
Thank you for your introduction. At the outset, I should thank the think tank of this conference to make psychiatric nursing as a theme. Not everywhere, as Natarajan sir said, not everywhere they are recognized. Not even at home, sometimes even in the conference too. So many times, even in a national conference spanning for 3 days, 1 or 2 topics will be in psychiatric nursing. I think I have to thank of all the things good things that is happening today. They're taking the theme on psychiatric nursing, and according to me, they are the queens of psychiatric wards. Yeah, as said, we just come for an hour in the morning. Sometimes we may not come after that in the evening. My junior doctors will take care. I think somebody who is attached to the ward is the psychiatric nursing people. I take an example of diabetic foot. You dress, you treat, you go to home. But if it is a psychiatric patient, say who is little disinhibited and misbehave with the lady nurse, while she goes to home, it also comes with it. The trauma happens. So here, the trauma is both with the patient and also with the nursing staffs. So I think you can very well ask for if you are in a private hospital, you can ask for a 20% high pay if you are in a psychiatric ward, because it requires so enduring task and it requires a lot of planning, and it is not easy that everybody, as said, can venture upon a psychiatric ward just because they have been posted there. So yes, sir has given a lot of examples for it. One thing I gave in my discussion is trauma. So trauma is going to happen. Trauma can be as small as somebody who's shouting at one corner of the ward, some disinhibited alcohol patient comes to you and misbehaves. Sometimes you will be very vigilant about suicidal patients. Suddenly you will attempt suicide and you will not be happy about it. The guilt will carry on with you until a few days to come. There is always guilt of commission and omission. So in this case, so the trauma is faced both by the psychiatric nurses and of course the patients are also there. So today I am going to talk about what you in a psychiatric trauma setting have to do to manage the psychiatric trauma better. So outline is what is trauma, how victims respond to trauma, what is psychological first aid, and what is trauma informed therapy, what is trauma focused therapy, and all this I am going to talk from a nursing personal point of view. Because there are certain things which psychiatrists do and there are many things which psychiatric nurses do. So I'm going to talk from nursing personal point of view. What is trauma? Unique individual experiences through a series of events. I use the word unique here, which involves individual's ability to integrate his emotional well-being. Enna nadandhathu, edu nadandhathu. After, I say, suppose there is an accident that you have witnessed and you are a part of it, the person will be numb. They don't know what has happened. They will be emotionally attuned. They will not be in their senses. So this is trauma. So there is an emotional experience to a trauma, and it is unique. Not everybody in that bus would have experienced the same trauma. Somebody who is little more less vulnerable will not address the trauma so badly. Trauma is not just the remembrance of the event. It is not just experiencing. It is the interpretation of the experience. It is not only the stress you experience in coping. For example, you experience an accident, next day you have difficulty in sleep. For a few days you have difficulty in sleep. That doesn't count for a trauma. Or not just the thought of it. So these are not trauma. Trauma is an emotional experience secondary to a series of events. Now there are two types of trauma I like to talk about. One is our big T, which is a one-time big event, for example an accident or a climatic calamity or terrorist attack, which everybody recognizes. Amapa periya prachana dhaan idu, which is time bound. It happens once in a time. We can validate. Everybody will understand. Even somebody who sees the news will understand. Yes, it is a big problem, and it is a very monumental. For example, our COVID-19 pandemic or tsunami. These are, they call as big T. Next one is small t. Every day it happens. IPR issues, fights, suppose transfers. Even government, you transfer, you go locate to a new place, etc. Financial problem. These are continuous, ongoing, and some people may not understand. They may not understand my financial worry. Suppose I met with an accident, they will very accident face pannirukar. They will understand. But if it's a financial worry, what they will say? Ellarukku varradane. As I said, the trauma is unique. My 10,000 debt, I will have one type of trauma for it. Another person will have a little less trauma for it, because it depends on a lot of factors. So let us not negate it. For example, bullying, abuse, punitive parenting, etc. So how victims respond? So when there is a trauma, let us take an example of a tsunami. I think this part of place people would have experienced. We are here in the early 2000s. So there will be shock and numbness. Maruthu poi apdiye oranju poi nippanga. Shock and numbness. They can be confused. They will be disoriented. They don't know what has happened to them. They can be panic attack. They can be anxiety. They can be anger and combative. They will become irritable. They will be shouting. They don't know what to do. They will be running around. There will be sleep disturbances, obviously. There will be somatic pain, especially older women. There will be an experience of worsening of somatic pain. Already they will have a lot of pain. They will have worsening of somatic pain because of the stresses. And they become, over the period of time, socially withdrawn. This is more of an acute phenomenon. Now, the trauma has occurred, the time has passed. Now the next stage happens is the chronic phenomenon. There will be increased substance use, because that will become an ability to cope. Suppose the person has lost his family members or a young son to tsunami. They don't know how to cope it. So there will be an increased substance use. There can be dissociation. There can be post-traumatic stress disorder, where the person will have repeated memories of the event and they will get palpitations, sweating, hypervigilance.